So one thing that I do want to point out here is, like I mentioned earlier, is one of my syringes is going to actually have air in this case. So my second syringe is always going to have 1 extra ml of air of the total volume that I need. So in this case, my calculation came out to be 4 mLs. Therefore, that second syringe is going to have 5 mLs of air. Okay, so you'll see that here in a second. Since I technically touched that paper or plastic cover, I have to respray my hands. Or gloves. I keep on saying hands, but it's really gloves. So if I say hands, please don't be confused. Just know that I really mean your gloves. Alright, so the first syringe, and what I mean by the first is going to be the one that has the regular needle attached to it. I'm simply going to just break the seal and put it back down. The second one is going to be the one that has that extra 1 ml of air. So remember, I actually only need 4 mLs of drug, but I need an extra 1 ml of air, and you'll see in a second why. Then I put that guy down. I go ahead and I'm going to break my ampule. Remember, we never break directly straight in front of you. We break to the sides. Remember, this arm has to be straight. And the reason why I say it has to be straight is if it's not straight, when you break your ampule, this hand has a tendency to flick it this way. Remember, for hazardous, we should not have any spills because it is a hazardous product. So that's why I say to keep your left arm straight. So now my pharmacist is going to take the top of the ampule from me. I'm going to bring the ampule towards me. These ampules, remember, since it is an open system, remember I said earlier with hazardous single draw to put it on the flat surface because there is a part on here where it's not necessarily flat. And I would hate for your ampule to tip over and spill on you. I'm going to then take my syringe with the needle attached to it. I'm going to uncap. This one, in order for me to withdraw everything out, your bevel has to be down. I know that we're used to always having the bevel up, but it should actually be down for this one because that's where the opening is. Another thing that I want to point out is this doesn't spill, okay? So don't be scared to do this part. I like to keep my needle here because I can actually visually see where my bevel is. So if I were to, for whatever reason, have my bevel up instead of down, I would be able to see that. So I'm going to go ahead and withdraw everything. As you can tell, I'm going to start tipping my ampule further down, 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 until I actually get everything out of there. Then my pharmacist is going to come again and take that ampule from me. Now this is where I use that second syringe. That second syringe, it doesn't have anything attached to it yet. So what we do is we put the needle about halfway in and we start to inject our medication into that syringe. Notice it's this way, not straight up, at least not yet. At some point, you will need to be straight up to get an accurate measurement. Since we have that extra 1 ml of air, we only fill it up to the 1 ml line, okay? Then this syringe on my right hand is going to be taken by my pharmacist. Now I'm going to go ahead and attach my filter needle. Uncap. Bring your bag towards you. Bevel up. and you inject all of your medication in, air and all. And sometimes you may notice that these filter needles, you tend to struggle with them when you're injecting the medication. That's because it's a filter. It's trying to do its job. If it basically senses that there's any type of particles that shouldn't be there, that it needs to filter out, then that's what it's going to do. So that's why sometimes you may notice that it's a little rough for you to inject your medication in the bag. So use your muscles and just shove that medication in the IV bag. I'm going to mix my medication, cap my white IV port, clean the outside of my IV bag with 70% isopropyl alcohol. Once it's dry, you apply your hazardous label, your patient label. We stick this into a hazardous bag, and that hazardous bag, once we seal that, we stick it into a transportation tote.